Hello everyone, and welcome to our videos on refractive eye surgeries. Today we're going to be talking about the first one, the most basic one, which is PRK. Refractive eye surgeries in general are procedures that can be used to help correct the refractive error in someone's eyes. So before we begin, I just want to go over a quick review of the cornea here, and I've drawn this model eye over here, and this is the very front of it. This is the cornea. So zooming into it, I've drawn the layers over here. I'm just going to go through these with you, and we can label them just to make sure everyone is fresh and ready to go for the rest of the video. So the first layer over here that I've drawn in red is the epithelium. I'll label it epi. The next layer is Bowman's. I'm gonna label that BM. And right under that in blue, we have the stroma. And underneath the stroma in brown is this tiny little layer called Descemet's. And under Descemet's membrane, we have the endothelium. So the layers that we want to focus on today, I'm going to circle here, and those are the stroma in blue and the epithelium in red. And the reason that those are important for PRK and for refractive surgeries in general is because most refractive surgeries require you to either remove the epithelium completely or make some kind of incision or flap with the epithelium so that you can access the stroma. And the reason the stroma is important is because it's the thickest layer of the cornea. It's the layer of the cornea that provides the most refractive power. And so all these refractive surgery techniques essentially require the surgeon to go in and remove precisely certain parts of the stroma so that the patient can see 20/20 afterward. So there's three main techniques for refractive surgery. The first one is the one we're going to go over today, is PRK, Photo-refractive Keratectomy. The others you might have heard as well, LASIK and SMILE. I'll make videos about those two later. So for PRK, I have made this slide over here where I've talked about the steps to it. So I'll go through all of these steps with you guys, and we can draw them out on the bottom here to make sure that we all get a comprehensive understanding of what's going on. So PRK, the first step is that the surgeon removes the epithelium layer from the cornea. So to demonstrate that, I'm going to go ahead and draw that in this box labeled 1. So I'm going to draw an eye over here, kind of looking down at the eye. So that's the iris and that's the pupil. So again, this is the iris over here and this is the pupil over here. So in order to better visualize this, I'm going to take my red pen and I'm going to draw an epithelium layer. And remember the epithelium we drew in red before, so I'm going to draw it red in here. So this is the very front of the cornea. That's the epithelium covering it. This is an untouched eye. This is exactly what it would look like. So all the incisions I'm going to draw in brown. So again, step number 1 is the surgeon removes the epithelial layer. So we're going to make an incision right around this epithelial layer over here. And it's going to be a full 360 incision, and the epithelium is going to come off. And so I'm going to draw that over here, kind of taking an arrow over here. Incision has been made, and the epithelium is now off the eye. It's to the side. So what does the eye look like after that? Let's draw that in step 2 over here. Again, we're looking at the same angle here. We have the eye, we have the iris over there, and we have the pupil in the middle. But instead of the red epithelium, and remember I'm going to draw the epithelium again on the side, it's no longer on the eye. Instead, we have exposed stroma. So if you remember, I drew the stroma in blue earlier when we were going over corneal anatomy. So I'm going to draw the stroma again in blue. So looking down, that's what it is. It's just exposed stroma. So step number 2, with the stroma exposed, a laser is used to correct refractive error. So this is with help of the computer. We shoot lasers at the stroma in very precise locations to thin it down exactly to the point that we need for the new refraction in this eye to be 20/20. And once we do that, we can show you what the third step is going to look like. So let's draw that down here again. Same model of the eye, got the iris and the pupil. So the stroma is still exposed here. There's no putting the epithelium back on the eye or anything. It's still exposed, but instead of putting the epithelium on, what we're going to do is we're going to take a contact lens. We're going to pretend this contact lens is pink, and I'm going to draw it kind of on the outside of the eye over here. And this contact lens is placed so that the eye is protected and the epithelium can heal over the eye. It does take a little bit of time because when you think about it, this is just a massive epithelial defect on the cornea. It does take a little bit for the epithelium to grow back naturally over the stroma, but when it does, if everything has gone well, the patient should have 20/20 refractive vision after the procedure. Now, there are complications that can result from this, just like with any surgery. With PRK and a lot of the refractive surgeries in particular, since you're cutting up the cornea, you are cutting up some of the corneal nerves, and that can lead to the most common complaint is dry eyes. Patients can also complain about other transient symptoms like glare, haze, redness. There are other serious complications that can happen as well, but those are the most common short-term ones. So thank you guys for watching. I hope this was helpful. I'll go over the other refractive surgeries in other videos. If you have any questions, please feel free to leave them in the comments, and I'll try to answer them to the best of my ability. Thanks for watching. Have a good day.